Hey everyone, Josh Guttman from Peachtree POCUS, back with another review. Up until now, the products I've covered have been handheld ultrasound devices. But today, we're taking a look at something different and genuinely exciting in the POCUS education world, the bone block. Most gel phantoms on the market are designed for vascular access. Very few, if any, are built specifically for musculoskeletal procedures. That's exactly what makes the bone block stand out. Inside the silicone polyurethane block is a detailed phantom finger, which allows learners to practice guiding needles towards bone and joint spaces, which is exactly what you want for MSK procedures. And on top of that, the bone block includes 4 echogenic beads positioned at the corners, giving you the ability to practice nerve block style needle guidance as well. It's a thoughtful addition that expands the utility of the Phantom beyond MSK alone. Big thank you to Medwyze, the parent company of the bone block, for providing the unit for review. The build quality is excellent. The block can withstand over 600 needle passes, which is remarkable given its $499 price point. And if you use the code Peachtree at purchase at theboneblock.com, you'll get a $30 discount. This block is sturdy, durable, and built to last. So if you teach musculoskeletal procedures like I do, it's absolutely worth considering for your courses. Let's take a closer look at what's inside the box and how it performs across different ultrasound devices. When you first take the bone block out of the box, here's what it looks like. It comes with this bone block guide that shows you a model of where everything is. And so it tells you each of the joint spaces over here, and then the spheres in the corner where you practice your nerve blocks. And so you won't be guessing where things are located, especially if you're early on. You'll already know based on this diagram. So here we have the bone block. We can take it out. And then we can place it down on the table. As you can see, I've already started using it, so it's got a little bit of gel on it, but it's thick, fairly light, but still very durable. So we're going to use the Mindray E5M ultrasound to begin with to look at the bone. And you can see that it shows up really nicely in long axis. You can see that joint right there in the bone, kind of right in the middle, and it looks really realistic. And it reached the end. Now if we're going to zoom in, you can see how realistic that looks. Let's take the depth a little bit deeper. And now if we're going to guide a needle, for example, to this bone, I'm going to use this 18 gauge needle. And you can see it actually hit the bone. I don't know if you heard the snap here, but this went right, and you can actually hit the bone and it feels like bone does. It's very hard. I'm going to do a little bit more superficial. And so there you can see that the needle shows up really, really nicely. There, you actually go and hit the bone, as I do right here. You can even do it short axis if you would like. I'm going to insert the 18 gauge needle in short axis and actually hit the bone pretty superficially. There you can see my needle hit the bone. So it looks really, really nice. Let's look at the spheres in the corner, which are supposed to be nerve blocks. So here's what kind of the sphere looks like when it's supposed to be a nerve block. So that's what it looks like right there. And there's one in each of the corners. You get some of the bone in here. And there's one of the spheres right there. So you can check them out in the corner, so they're good to look for. And you can also guide your needle in various axes. So I can turn, it's spherical, so I can turn long axis and actually guide a needle right there. if I would like. And you see I'm hitting that sphere really nicely from the side. So here's what it looks like with the Butterfly iQ3. You can still see the bone looks very realistic. So even under handhelds, it shows up really nicely. I can certainly guide my 18 gauge needle. It shows up really well over there. I can guide it to anywhere I want to go. You can look at it in short axis. And you can see that my 18 gauge shows up really nicely there. Now we can look at the spheres. Here's the sphere. Right here shows up really, really nicely. You can guide your needle right to the sphere. Whether it's in long or in short axis. Yep, right next to it, right there. I hope you enjoyed this review of the bone block. If you attend any musculoskeletal or nerve block courses through Peachtree POCUS, you'll definitely see this phantom in action. It's already becoming a go-to tool for our workshops. And if you're interested in purchasing one for yourself or your trainees, head to theboneblock.com. Don't forget to use the promo code Peachtree for $30 off your order. And if you're in the market for a handheld ultrasound device, make sure to explore the rest of the reviews on the Peachtree POCUS YouTube channel. If you want personalized guidance, we now offer 2 tiers of handheld ultrasound consultation services. The standard is filling out a detailed questionnaire and you receive a customized device recommendation. And then there's our white glove service, a higher touch option where you meet one-on-one with me and we review your POCUS needs and we personally connect you with company representatives from decision all the way through purchase. It's a very small investment to get expert guidance before spending thousands of dollars on a device, especially when many handheld systems don't offer refunds. And you will find almost nobody who has tried so many of them in clinical practice like myself. And you can learn more at peachtreepocus.com/handheld. And I'll see you on the next review.